conversation, which I'm very much looking forward to. So in terms of the introduce the session and introduce the three of you.
Ways to promote and as a journalist and as a human rights activist and as a...
Lead poisoning due to severe risks, especially to children and pregnant women in low and middle income countries. Clear improvements indicating the effectiveness of the response package. That while the primary responsibility for combating lead poisoning threats with our government, international organizations play a co-lead for a new cooperation mechanism among member states, promoted in Tbilisi in November 2023. And government regulations to
accessible. They just have to be seized upon. And finally,
we independently are developed the divisions of why we find very that's a huge opportunity for regular migration.
Thank you very much. Well, first of all, thank you very much. I want to express my gratitude to USAID Administrator, Madam Power, and dear friends and colleagues. Thank you very much for inviting us to highlight Georgia's success story. I also want to mention that lead poisoning stands out as one of the most pressing public health challenges in the world. It is also crucial to recognize that this challenge extends beyond Georgia and other countries. It is a global issue. Recent reports highlight that an estimated 1 in 3 children worldwide suffers from lead poisoning due to exposure to common sources like paints, informal battery recycling centers, cookware, cosmetics, and in some instances, spices, as was mentioned. Also, it is crucial to understand that lead poisoning contributes to nearly 1.5% of annual global deaths and poses severe risks, especially to children and pregnant women in low and middle income countries. As for Georgia's success story, first of all, multiple indicator cluster surveys conducted in our country in 2018 by UNICEF with support from USAID revealed that 41% of children aged between 2 and 7 years had blood lead levels above an acceptable threshold. These data triggered immediate action by the government. We swiftly initiated relevant steps aimed at mitigating and preventing lead poisoning in the country. The National Response Package launched in 2019 with support from UNICEF and USAID, including the wide-scale awareness campaign, lead biomonitoring among children and pregnant women, establishment of the Chemical Risk Factor Laboratory, and development of a lead surveillance system to monitor blood lead levels and identify sources of exposure. In order to identify the sources of exposure, we have started the assessment of environmental conditions within the same program. These interventions result in speedy improvements indicating the effectiveness of the response package. At the 4th year of the lead response surveillance program implementation, we have observed a remarkable 75% decrease in the prevalence of blood lead levels among children in the region, with the highest initial prevalence. In order to sustain these achievements, Georgia has bolstered the regulatory framework concerning the lead-containing products. Aligned with the EU Association Agreement since July 2023, we have implemented strict technical regulations controlling the manufacture, sale, and import of construction paints. Legal limits have been set to govern the production, sale, and import of paint with higher lead concentrations. Additionally, to address potential risk, Georgia has enhanced its regulatory framework concerning lead migration in toys. Relevant regulation in force since 2021 focuses on ensuring the safety of toys, incorporating legal limits to govern the production, sale, and import of toys with high lead migration. We are also actively working on establishing government regulations to ensure the safety of these products, aligning with EU legislation and following WHO recommendations. In order to improve the ambient air quality monitoring in the country, we have started continuous 24/7 sampling and analysis of heavy metals, including the content of lead in major cities. The current results show that ambient air pollution may not be considered as a source of lead exposure. We also recognize that while the primary responsibility for combating lead poisoning rests with our government, international organizations play a pivotal role in this global effort. Georgia has been fortunate to receive substantial support from international entities, partners, friends such as USAID, UNICEF, WHO, Germany, and the Arctic University of Norway. This support is directed towards strengthening chemical biomonitoring, building laboratory capacity, establishing surveillance models, developing communication campaigns, and training human resources. Importantly, our active involvement in the European environment and health process showcases our commitment. We were honored to be selected as a co-lead for a new cooperation mechanism among member states, promoting the use of human biomonitoring in the WHO European region, led by Germany. And this partnership, dear friends, launched at the 7th Ministerial Conference on Environment and Health in 2023, so as hosting the first meeting in Tbilisi in November 2023. And this gathering brought together members of the partnership to agree on priorities and promote human biomonitoring work in the WHO European region. So leveraging these invaluable partnerships, Georgia is steadfast in its commitment to strengthening both human and technical capacities. We aim to further develop our lead surveillance systems, conduct thorough research on sources of lead poisoning, implement effective mitigation strategies, and contribute progressively to the reduction of the burden and lead exposure. To conclude, the World Economic Forum provides us with a unique opportunity to reinforce and elevate our collective political commitment to a shared vision, a world free of lead poisoning. Adopting rigorous monitoring, strict regulations, and fostering international collaboration is Georgia's commitment to addressing lead poisoning comprehensively. And I believe that a united global community, we can achieve greater results, ensuring a healthier and more prosperous future for generations worldwide. Thank you very much.